In this clip here, I'm going to be sharing some really good information in regards to the healthcare system when it comes to Islamic history and experience. As you can see here on the screen, this is from the EthnoMed Educational Resource Platform. And I'm just going to scroll through here and kind of read through some of this information, which I feel is very good to learn and understand when it comes to the Muslim Ummah and how health is approached in that regard. So it gives you some information here about who the authors are, community reviewers, the date this information was authored, so on and so forth. So we've got the introduction here, and I'm just going to read through the first couple of sentences just so we can understand what this information is going to be about, what is provided here. So this one says, this article provides a short historical review about healthcare and Muslim experience, as well as current general information about Muslim people and their main observances and concerns in the Western healthcare system. Muslims in the U.S. come from many different cultures and schools of thought. A detailed explanation about differences is beyond this article's scope and purpose. This document focuses on similar beliefs and observances with regard to healthcare, illness, and death and dying among Muslims in the U.S. So it's going to give you here some general information. I think it's really nice that they kind of explain here through the 5 pillars of Islam how religious obligations, um, according to the Quran, have a lot to do with the approach to health in the medical system. So it'll just give you a general overview what living according to the Sunnah is, as it says in this section here, the Sunnah practice and law, or Sharia. And the word Sharia here, it gives you kind of a statement to kind of broaden your understanding of what Sharia means. It states here, Sharia considers Muslims as one community, an ummah. So understanding that when it comes to Muslims, even if they come from different countries, the same focus on the collective is something that keeps Muslims connected in this society that we live in. So as it goes on here, it talks about the 5 distinct schools of fiqh, or Islamic jurisprudence. It'll give you some historical background into pre-modern medicine in Islamic experience. So I'm going to read the first sentence here, which I think is very interesting. It states here, there are no specific codes for medical treatment of physical illnesses in the Quran. In Islamic tradition, the difference between health and illness was and still is perceived as balance and imbalance, or the humoral theory. Muslims have historically sought the Quran as a healing source in times of psychological and spiritual distress. When experiencing physical illness, Muslims have also been open to the rituals and medicinal practices of different traditions, including those of non-Muslims. The following sayings of the Prophet are used to encourage patients to seek proper treatments in times of illness. So I'm just going to read what is provided here. It states, there is no disease that Allah has created except that He also has created its remedy, which is a really good one when understanding, a lot of the way Muslims approach their health. Um, from being someone who is very much into the holistic health and natural health and healing world, I really do resonate with holism and treating your health from a spiritual standpoint, physical, mental, all together as a collective. So that's definitely something that is very much seen here when it comes to understanding how Muslims live every day. So it gives you some information about the modern period here, a contemporary approach to healthcare, a lot of really thought-provoking information. It talks about death and how those things are completed and understood through faith, funeral rites, regulations in Islam. Then you'll get some information here about religious and cultural facts and providing care. Lots of really good things. Diet and food restrictions, especially understanding this month of Ramadan, how that plays into your health and your wellness, and how it really is truly a reset of the entirety of your system. So it's really good to kind of do your research into what exactly is it that a Muslim believes? What is it that you can take away from when understanding a lot of the disparities that we have when it stems from a difference in belief, not just, a deliberate neglect of other understandings. It is just the way that a lot of Muslims live their lives are not like everyone else, and it's not, a negative thing to not live based on what everyone else does. So I think it's good to understand why certain things are the way they are, where the kind of information is coming from, and understanding that it is all based on the Sunnah, and just really providing yourself with an insider into who are the Muslims, what is Islam, what really, um, you know, is being practiced here, what is Islamic medicine, how is that enacted in everyday life. So I think this is a really good resource. It also gives you here some related materials. So this one talks about Ramadan and information for healthcare providers to understand. I think there's a lot of misinformation when it comes to what Ramadan is. People don't really have a good understanding of what fasting is. People think that Ramadan is about starving. There's a lot of, misinformation that a lot of people don't understand and otherwise are not trying to understand. But I feel like this is definitely a really good resource. It also gives you an overview of, specifically into the Somali community, what, their diet looks like, understanding, as it states here on number one, religious prescriptions, discussing the influence of, Muslim religion and how it affects Somalian immigrants and their diets, and just kind of really digging deeper into things and not, approaching everything based on misinformation. So I think it's really good to understand people, understanding, the Muslim Ummah, how diverse it is, and how to truly understand people who differ from you. So I will definitely leave a link below for where all of this information can be found. There's definitely a lot that you can learn about a lot of really, targeted groups of people, and just provide yourself with, some different perspectives instead of joining the majority and perpetuating hatred towards people when you otherwise do not have information into what the other side looks like. So I definitely will provide those links in the description, and I hope you enjoyed this overview for the Ethnomed platform.